Good afternoon. Thank you everyone for coming. My name is Nick Brown. I'm the United States Attorney for the Western District of Washington. I am pleased to be joined today by a number of our partners from the law enforcement community to talk about a significant law enforcement operation that has lasted many months but culminated in the last couple days. With me today, standing up here, is Special Agent Kelly Smith, the Assistant Special Agent in charge of the FBI, Jake Galvin, the Acting Special Agent in charge of the DEA, Chief Adrian Diaz, the new Chief of the Seattle Police Department, and Special Agent in charge Robert Hammer from HSI. Yesterday, law enforcement officers and agents in this district executed court-approved search warrants at 14 different locations, both here in Washington State and in California. Multiple arrests were made involving 3 interconnected drug organizations. As a result of those arrested yesterday, 11 people are now in custody. And in addition to a related case in September, we arrested 6 others on a separate indictment, meaning we now have 19 people charged related to these 3 different drug trafficking groups. In the various searches that were executed yesterday, we seized more drugs, but most importantly, a number of firearms. 67 seized yesterday, bringing the total number of firearms seized as a result of this investigation to 110. These defendants were using firearms to protect massive amounts of drugs being brought into this district in Western Washington. Fentanyl, methamphetamine, heroin, and others. And during the course of the investigation, when law enforcement stopped vehicles or took off an RV carrying loads of drugs, these defendants were not deterred. When the first group was charged in September, and it was clear that law enforcement was using federally approved wiretaps to support this investigation, it did not deter their conduct. Investigators indeed heard the members of the groups talking about their occurring efforts to recruit more individuals to this work. I want to tell you a little bit about how these cases unfolded. In early 2021, one of the lead defendants in this case hit the law enforcement radar, and over the next year, we obtained court-authorized wiretaps to tap their phones related to the drug trafficking organization. One thing that we discovered early on is that there was more than one groups that were source of the supplies of these drugs into this district. So law enforcement officers started working on identifying the various sources of supply, and ultimately it led to that group being identified and the arrest in September and then earlier this week. While the sheer quantity of drugs and some of the pictures of the drugs that were seized are here today may stick in your mind, the numbers that motivate us, that motivate our law enforcement officers, is something else. As of mid-October of this year, there have been 743 confirmed or suspected drug overdose deaths in King County alone. Of those confirmed deaths, about 68% are linked to fentanyl. It's just October, but we have already exceeded the total number of overdose deaths during last year. Fentanyl is linked to 389 deaths last year, and this year fentanyl is already linked to 462 of those deaths. I want people to recognize, and that means everyone in this community, that we are facing a serious crisis. And while the cases that this office brings and the cases that our law enforcement partners investigate help slow down the flow and help save lives, I think we all recognize that given the gravity of the problems that we're facing, that the law enforcement piece is only a temporary part of the solution. In order to seriously address the crisis that this community and indeed communities across the country are facing, it takes multiple entities, multiple organizations, multiple actors to really make this a safe and healthy community. It takes much more than law enforcement. But I am excited about the work that we have done in this district and stopping these particular organizations. I want to thank not only the individuals here, but our partners in California, including HSI in Los Angeles, for their work on this investigation and helping to execute all of the search warrants and arrest warrants yesterday. But here in this district, the FBI took the lead on the investigation, so I want to turn the podium over to Special Agent Smith.
First of all, thank you for joining us today. I'm honored to be here with our counterparts from the DEA the Seattle Police Department, and HSI, and the U.S. Attorney's Office. This effort would not have been possible without our partnerships. Yesterday's operation emphasizes our continuing commitment to the community to counteract the large volume of illegal drugs and firearms that are being trafficked into our community and targeting the sources of supply. The Paleo and Gutierrez Valencia drug trafficking organizations came to our attention in 2020. They were transporting large shipments of narcotics into our area from Mexico. We were able to build a long-term investigation, and parts of that are still ongoing. We interrupted, as I mentioned, several massive shipments, and ultimately seizing those drugs and dismantling those organizations will negatively affect the sources of supply here in the Seattle area. I also wanted to emphasize the large scale of this operation. Behind each of these agency representatives up here in front of you are literally hundreds of law enforcement officers and employees working to keep our communities safe. Just for yesterday's operation, we had more than 100 personnel from the FBI, and I know there were more than 300 in total executing our takedown. And this work didn't begin or end with yesterday's activity. As the U.S. Attorney's Office mentioned, these investigations takes months and years, and you can notice that this one was over a year and a half. The amount of methamphetamines and fentanyl removed from Western Washington during this investigation quite likely prevented some of these overdose deaths. I'd like to point to you this poster. This shows you just a small amount. That's 1 kilo of fentanyl powder. And as you'll hear a little bit later today, that is just very small amounts are deadly. The Washington State Department of Health reports that each day 2 people die of opioid-related deaths in Washington. Often mixed with other illicit drugs, many users are even unaware that they are ingesting fentanyl. Drug trafficking organizations feed upon the most vulnerable in our society and continue a devastating cycle of violent crime and addiction that destroys families, communities, and our individual quality of life. Together with law enforcement across the country, we're committed to disrupting these organizations, combating this crime, and reducing the availability of illicit narcotics. I'll now turn it over to Jake Galvin from the DEA.
Thank you. Good afternoon. As you said, my name is Jacob Galvin. I'm the acting special agent in charge for the DEA here in Seattle. First, I'd like to thank Assistant Special Agent in charge Rob Saccone and Group Supervisor Dan Murphy, who oversaw this investigation for us. The amount of narcotics seized in this investigation was staggering. In the first half of the investigation, together we seized 330 fake fentanyl pills. Our DEA lab finds that 4 out of 10 of those pills contain a lethal dose of 2 milligrams or more of fentanyl. If you take into account those numbers and the amount of fentanyl seized in the first part of this investigation, that's enough fentanyl to kill over 132,000 people. To put that in perspective, that's the amount of people that it would take to fill Lumen Field twice. Fentanyl is the DEA's #1 priority. The cartels that are responsible, they're ruthless, as we've seen by the amount of firearms seized in this investigation. And they're relentless and adaptable, as we've seen by, not only did we seize 1 RV filled with narcotics, but we seized 2. The cartels will also exploit any means necessary to get their deadly drugs into American communities. This investigation shows, with the partnerships that you all see here today, how vital our partnerships are to keep our communities safe, healthy, and free of dangerous narcotics. Thank you. Chief Diaz.
Good afternoon, everyone. Thank you for all being here. I've stood in front of you many times to talk about the serious problems plaguing Seattle's communities. I've talked about the increase of guns, and shots fired, and shooting assaults, and the fentanyl that is violently harming our communities. People continue to fill our neighborhoods with drugs and guns, and they prey on and victimize all people indiscriminately. And members of all of the communities are dying, as people mentioned, as we have in this photo over here of just how many overdoses that we're experiencing. We know this, and we see this every single day. I'm proud of our officers and detectives committed to making a difference in addressing crime every single shift. Saving lives is why SPD is devoted to getting firearms out of the hands of criminals and illegal narcotics off the streets. Not only do I applaud the officers and investigators, but also the special workers like our SPD detection dog, Devin, who is actually up in the corner of this photo with a bunch of the drugs, the narcotics canine who helped sniff out some of the drugs in this week's massive roundup. This life-saving work is important, especially right now. This week, a city audit reported that an increase in methamphetamines throughout the use of Seattle. And as ASA mentioned, that we have 468 fentanyl-related deaths, and we're on pace to surpass last year's record high fatal overdose numbers. But we're also expected to exceed the number of guns SPD has recovered or took into custody in 2019, when we had 400 more officers. So we know how many guns are out in the streets. They're running rapid, and we've got to be able to address that. And having over 100 plus guns just in this operation is massive. Criminals with guns are ending far too many innocent lives, as we saw last week when a gunman shot and killed a beloved Central District store owner, as well as a youth football coach. And here in Seattle, year to date, shots fired are up 26%. We've had 633 shots fired compared to 501 last year. And yes, thanks to our ongoing local and federal investigative partners, dozens of those weapons have been rounded up recently, in the recent weeks, including these firearms that have been taken from actual home in Ballard. We don't have a picture up on the board, but these are just some of the weapons. These joint operations will certainly save lives, but we all need to do more. And as I walk and drive the streets of Seattle, I often witness as desperate people slumped over with aluminum foil still in their hand, unconscious from a dose of fentanyl. And I know you've seen them too. And yes, our recent arrests and seizures will go a long way to keeping some drugs out of some of the people's hands. However, all city, county, and state agencies need to come up with a comprehensive and coordinated plan to hopefully help address this public safety crisis. And law enforcement, including those that are standing in front of you today, cannot do this work alone. We need to support our partners in public health, education, community services, and private sectors to come up with ways to prevent people from turning to guns and illegal drugs for their livelihood, for an escape, or for whatever reasons motivate them. Because these behaviors are killing them. And yes, the months-long efforts of SPD, DEA, FBI, HSI, U.S. Attorney's Office, and our other partners in this operation resulted in many arrests and seizures. But now I have a message to those who are still out here harming our neighborhoods. We will arrest you. We will come after you if you continue to hurt people. It might not be today or tomorrow, but we will not rest until we address those that are preying on our loved ones. And to our Seattle community, we all need you. We need all of you. We need our entire community to educate each other about the dangers and how to avoid them. Today, we've seen law enforcement in the battling rise in deadly drugs and guns. And I ask all of you, what are you doing now? Thank you.
I want to make two final points, and then we're happy to answer questions. One, as Special Agent Galvin was talking about, the first half of this investigation received 330,000 pills of fentanyl. 330,000. And he talked to you a little bit about how many of those pills likely contained a deadly amount. The other thing I want people to think about is that this investigation and the seizure of drugs and firearms, this is happening right here in our neighborhoods. The chief mentioned the activity in Bothell. The picture of those firearms were seized at a home in Ballard, not too far from here. Law enforcement yesterday executed a number of arrests about a mile from where I live, in West Seattle. This is all around us all the time, and people need to be diligent of this problem and take it very, very seriously. But it's not only here in Seattle, it's certainly not only here in King County, all up and down the I-5 corridor in the Western District of Washington. We are seeing communities devastated by the impacts of fentanyl in particular, and firearms especially. And this is a problem that spans across this district, across this state, and across this country. So thank you very much. We're happy to take questions.
The indictment documents speak in at least one place of the trafficking coming up from Mexico through LA up to Seattle. What percentage of the local business is that?
The vast majority of the work that our office is engaged in, and our office is focused almost exclusively on drug cartel, large organization drug trafficking. The vast majority of that work involves Mexican-based drug cartels bringing their drugs up and down the I-5 corridor. We still do have actors who are manufacturing those drugs here locally or in other states near us, but the vast majority of the focus of our work is cartel-based, and most of those cartels are in Mexico.
I think Kelly was the one who mentioned the name of the cartel.
Agent Smith.
Which one?
Agent Smith.
Agent Smith?
You said Kelly. Sorry. Go ahead.
Sorry. Kelly was the one who mentioned the name of the cartel, right? What have you learned about that cartel? What's being done to stop operations or, curtail operations in Mexico with Mexican authorities? And what have you learned about how they're getting these drugs across the border?
Sure, and I don't want to speak too much about an ongoing investigation because even though we do have existing indictments, there is more work to be done, and I think all of us recognize that. But we are focused on the cartel-based organizations and how they interact here in our district. These cartels have a lot of actors throughout the West Coast and indeed across the country. And we try to go as close to the top, if not the top, as we can. And we have ongoing investigations involving a number of cartel-based activity, but they are sending their actors and their players into our districts, and those are the people that show up. And so you have people who are directly tied to the cartels as well as relying on local redistributors. What I'll say is the amount of drugs that we are talking about is huge, and those are coming across the border in cars and in trucks. Some of that happens sometimes manufactured here locally, but we're talking about such huge quantities of drugs that it takes a concerted effort and organization to bring those across the border.
What can and needs to be done to better secure the border so that they don't get across? You had 200 pills seized in Seattle in 2018, and in 2021, 650,000 pills. So the number of pills coming into this area is exponentially jumping. So what has to be done to better secure the border?
Yeah, I mean, we've had drugs coming across the border for generations now, right? And so certainly we have to be focused on everything that we can do to stop the drugs from coming in our country. If they're coming across the border, we need to do more to interdict drugs coming across the border. If they're being manufactured here, we need to find ways to stop those from happening.
Can you be specific?
Can I just say something real
Sure.
quick? I apologize. I was actually just meeting with the chiefs down and around California's border, and to give you some example, they were roughly cost for a fentanyl pill is anywhere from 15 to 35 cents a pill. Here we're roughly averaging about $1 to $2 a pill, and about a couple years ago we were about $15 a pill. So you could just see the massive amount of pills that are coming into our community, and then it drops once you have a huge amount of supply, it drops the actual cost for the pill. But when you're actually experiencing it on the border, they're actually around 15 to 35 cents. So just imagine just how many pills are coming through our border. So I think that does leave the question. There are a lot of discussions about immigration, a lot of discussions about border security, but at the end of the day, we have to make sure that we address the prevention side, that we really try to make sure that people aren't driving to fentanyl as a way to mask, whatever issue that they might be having. So I think that we really have to focus on our prevention side and really see it as a public health crisis.
Gene?
Well, sort of following up on that point, I mean, you're talking about the relentlessness of the cartels, the continued recruiting efforts while the investigation was going on, and the apparently infinite supply of fentanyl and meth. I mean, I guess, why are you confident that seizures like this do make a difference?
Well, I'm confident for a couple different reasons. One, as the special agent from DEA talked about, so many of the pills that we seize are deadly. So everything that we can do to stop those pills from being ingested and being used, particularly by young people. We've seen an alarming number of young people have overdose deaths in this district and in this country. So every pill that we seize saves lives. But I am perfectly aware, and I think all of us up here recognize that what we're doing is slowing down the problem and not stopping the problem, and that we can arrest a group of individuals, we can take these folks off the street, we can make the community safer, but these are temporary solutions. In order to have sustainable, healthy communities, you need to do all these other things, and that's, when people ask me, how do you solve the drug problem, I always say it's everything, right? It's safe and stable housing, it's an economy that works for everybody, it's security at the border, it's drug and mental health counseling. All of those pieces are vital. We are not going to arrest everyone who's trying to distribute drugs in our community. Our jails are not too big, and we've had that approach in the past, and it's proven to be ineffective. The way that you make this lasting is by everyone outside of law enforcement also and fully engaging in this work. And it is hard and it is expensive, but we have to be committed to it.
something you said here, this is happening right here. Talk a little bit about where some of the warrants were served yesterday morning. I've seen it happening in the West Seattle area specifically. We're talking about in neighborhoods, parks. I mean, describe where some of these warrants were served.
Well, all the search warrants were served at residences or for vehicles. So we have in Ballard and in Bothell and in West Seattle, and there's more locations that we can talk about. But those are in people's neighborhoods where they live with their families. And, I read on the West Seattle blog people waking up to some of the flashbang and activity from law enforcement. It's not too far from me. And so this is all around us in this district.
You mentioned, I think this was a question more for the DEA, but 132,000, it could have prevented 132,000 deaths. What do we know about the people taking fentanyl right now? It's younger people, and so is it correct to say that the demographic out there that could have been saved are largely people like who are young, 20 years old?
I don't know if we have firm data on the demographic, and I'm happy to have Jake weigh in here. What I will say is it's everyone. We're seeing more and more young people take it, some taking it knowingly, some taking it thinking they're ingesting some other opioid or a pill. There was a really, I think, eye-opening article the other day in the Wall Street Journal about people using cocaine and finding that cocaine laced with fentanyl. And all the people that were highlighted in that story were professionals. There was a lawyer, there was, I believe, a teacher, people with families, people with full-time, stable jobs. And so we can see and look at people who are laying on the street with tinfoil using fentanyl, but it is not just them. It is your friends, it is your neighbors who are using drugs. Again, sometimes they know that they're taking fentanyl, sometimes they think they're taking something else that might be perceived to be safer. And we're seeing more of that hit young people. But from my experience, and I think what we're seeing is this number of pills is not being used by high schoolers. This is being used by a wide swath of our community.
With regards to the arrests, can you kind of go through who these people were? Were they higher ups in the cartel? Were they middle people? Were they the local distributors? Where were they?
Yeah, so these are people, they kind of run the spectrum. My office does not prosecute drug users, does not focus on the low-level people. In order for us to bring a federal indictment, we are focused on people that we believe to be playing significant roles in the activity. So anytime we're focused on an organization, we try to go as high to the top. This case involves people that were fairly close to some of the leaders of these organizations. It also involves local redistributors. So we have people that are living here and working here on behalf of these drug organizations and these drug groups. We also have people who are more closely tied to the cartel, some down in California, some in Mexico. But we're focused on people who are distributor level individuals that we can target.
Mr. Brown, these folks are operating with impunity, except for your actions, right, and the folks behind you. So they're all around us. These weapons, these firearms, they seem emboldened and are carefree, even when 20 years ago are arrested and charged. How do you convince those people from even entering that kind of?
Yeah, I take your point. I don't think they're operating quite as loosey-goosey as that might be framed, but we've been doing this work for a long time, right? And every U.S. attorney across the country, one of their principal focuses is prosecuting drug trafficking groups or individuals or cartels. And we try to tackle as much of the problem as we can, recognizing that there's more to come and recognizing that when we take these folks off the street, and many of the people are facing mandatory minimum sentences in prison, that there's going to be an effort to fill those shoes by others. Because, as the chief was noting, we have to address the demand. We cannot prosecute and arrest our way out of these problems. We have to address the demand. We have to be educating people about the dangers here and discourage them from engaging in this sort of activity. The other thing I want to highlight, and I used to be a line prosecutor in this office for a number of years and have been gone before I came back in this role. One of the major changes, I think, in terms of what law enforcement is seeing across this district, certainly, is that more and more people have firearms. It used to be you could focus on the most dangerous offenders or the ones that we knew were driving violence in the community. But nearly everyone law enforcement encounters these days is armed. And that is not just the top level guys, it is the low level mopes, it is a lot of young people. I mean, the chief talked about the number of guns that have been seized this year by SPD alone with a fraction of the workforce. Guns are everywhere in this community. And that is a huge part of the problem that we are seeing because it makes their job dangerous, it makes everyone in the community dangerous. I mean, you know, to realize, I don't know how many dozens of weapons were seized from a home in Ballard yesterday. That should make people scared. It should make them furious, frankly. And so we have to be very focused on the trafficking and the availability of firearms in this country, because that is a uniquely American problem. Sir?
Yeah, to follow up on that same topic, were military-grade weapons seized yesterday?
I try not to, how you define military grade, I guess, is a little bit in the eye, but what?
Obviously something you and I can.
Sure. If you have an AR-15, which was originally a military-based weapon, I view that personally as military grade. And yes, some of those weapons were seized yesterday. Not just handguns, but AR-15s, shotguns, and the like.
Do you have a sense for how they were able to obtain all these weapons? Do you have any general idea?
What I would say generally is the types of weapons that we are seizing these days are being stolen from people's homes. The number of stories that we hear about of people unsafely leaving their guns unsecured without a safe in their homes or in their cars around their families quite often, that is a huge source of the supply in this country. Guns that people bought legally then being stolen. We've certainly seen firearms being stolen from licensed gun dealers as well. All those firearms are being manufactured not in Washington. There's not a firearm manufacturer here in the state of Washington, so they're being brought in from out of state, not from Mexico like the drugs.
They didn't purchase these weapons. They didn't go to a store and purchase these.
I can't speak specifically about all 110 of the firearms. And I don't think that any of the individuals that we charge purchased them. Quite often we're seeing people doing straw purchases, so somebody who's allowed to purchase them, purchasing on behalf of others, but I can't speak specifically to the weapons that were seized here. Sir?
Can you just, every day we cover stories about people who say, I can't believe the crime in my neighborhood. Can you just draw a line between what's going on here and some of the street level issues that people may be noticing here?
Yeah, give you an example of as you look at the fentanyl overdose or a fentanyl pill. So if you're looking at say $1 to $2 a pill, and you think about how much it might take to cover a person's high for the day, to address certain needs. I couldn't tell you how many it would be anywhere. It could be up to 30, it could be up to 15, depending on the person. But if you're thinking about like how much it would take to keep that habit going, so if you're looking at people that don't have the money or it isn't coming from a professional background, but is on the streets, they're having to steal just to keep that habit going. And so when you're stealing, you're not just stealing $30, $45 worth of stuff. You're stealing $100 worth of stuff to be able to keep your supply, to keep your habit going, to feed your habit. And so think about all of what we've seen when it comes to burglary and car prowls, and all of the increase that we've seen over the last couple of years. And I'm not saying that all of it's associated with fentanyl or all associated with the use of drugs, but we are seeing an increase in the amount of thefts from car prowls. And that is a concerning effort. So to me, it is a driver of keeping people's habit going. And so we have to be able to look at the whole system of crime. So it does start from sometimes in some areas, the car prowl to burglary, to then the person being able to use it, but also the people that are actually dealing this and harming and preying on our community. And you think about 110 guns that were recovered. I mean, that's about a tenth of all of the guns that we've recovered so far this year. And that is because we're about 1,014 guns that we've recovered this year so far. So that is a huge amount. That's a significant dent in making sure that our community is safe from people shooting each other. And so we need to make sure that those guns are off the streets. We're using for an AR-15 to be out there, and we have a number of shootings that have been in AR, and we test every single gun. So we're paying attention to if that gun has been stolen or if that gun has been used in a crime. And about right now, we will look at all of our IBIS and IBIN testing. So it's a national ballistic system of testing. And about 35% are guns being used in multiple cases or more. So they're being used twice, not twice, 3 times, 4 times in some instances. So we have to make sure that we're doing everything we can to get those guns off the streets. And this is a product of that.
Chief, given, you mentioned all the guns seized and everything, what kind of planning from a law enforcement perspective goes into these types of raids? You don't just show up you know, an hour before. I mean, what does it take to plan something like this?
Well, as everyone's kind of mentioned, it's been over a year-long investigation. We have spent months on this investigation, so we're trying to get as much information as we can for any place that we're going to be addressing, whether it's a house or whether it's a vehicle. So where the place is to safely take down a vehicle, where it is on the residence, knowing the rooms, knowing every aspect of that house before we do that. Because, yeah, officers are trying to make officers. We brought in a whole tactical team from different agencies to participate in this, and they have to know those layouts. They have to know exactly what they're looking for, and what they're also trying to make sure that keep their safe at a high level. So it isn't just like tomorrow we're going to go and hit and address a house, especially when you have a house in Ballard that has multiple guns. You have to make sure you do a lot of planning in that effort.
Chief, your staffing has been tight in the last couple of years. What are you doing as a department head to try to do more of these? Not a raid to this extent, but I mean, just getting these drugs off the streets every single week.
Yeah, one of the biggest things is having good partnerships with the federal departments. Because we don't have as many officers, like I said, I mentioned over 400 officers that we don't have, and we're still going out and doing a lot of great police work. But it is partnering with the feds to actually supplement that level of loss of officers, and having the ability to have these types of investigations where we're end up, you know, covering thousands and hundreds of thousands of pills to make our city safer. Because at the end of the day, for the patrol officer, they're seeing that overdose. They're the ones having to respond to that overdose. They're the ones having to respond to, you know, a person in a you know, could be on the sidewalk, literally with the tinfoil, you know, using the dope. And we also are responding to the thefts and car prowls, be able to feed their habit. The catalytic converter thefts that continue to increase massively over the last couple of years. So right now, having these partnerships really help us be able to do our job a lot more effective, even though we have less staff.
You mentioned that a coordinated plan to address this is needed. How does that look in your mind regionally, and how do you think that would help?
Yeah, so you know, right now we have to really focus on the user, and to me, if we can have less users, you're going to end up seeing people are not going to bring as much in because they're not going to be selling as much. So we have to be able to find, like when you talk to families that have lost their child because they've used fentanyl just one time and they had an overdose and died. Like it's such a tragic thing, and so we have to make sure that we're educating people on just making sure that anything that they ingest, that they know exactly what they're ingesting, and that that we're mindful of that fentanyl can be out here, and listen, we understand one pill can kill. We always say that because we don't know if it's got a double amount of fentanyl in it that actually can kill, or it could be just an amount that keeps the high going. And so we really need to make sure that we're educating people as much as we can. It has to be a blanket campaign. It has to make sure that we're putting money into people in drug and alcohol counseling and making sure that they're getting services, because that helps, again, address their habit. And then the other thing, we've got to support mental health. If we know that people that are mental health are finding themselves medicating themselves with drugs. And so we've got to figure out ways to make sure that we're supporting our mental health people, our people in crisis.
Let me add one piece to that, Chief, because I fully agree it needs a coordinated regional, national approach to some of these issues. And so many of the drivers that we're seeing to people engaged in drug activity, the user end folks, are people who can't afford to live in this community anymore, are people who lost a job during the pandemic, are children not aware of the danger of what they might be ingesting. And law enforcement plays a very important and indeed vital part of that approach. But we also need community programs to provide after-school programs for kids to distract them and educate them about the dangers of drugs. We also need affordable housing so people aren't living on the street more closely aligned with drug activity or violence. We also need people to be able to have a job, to afford all the other things that support a stable family and a stable foundation. Without those other pieces, we're going to keep doing this work. And we're going to keep having these press conferences and talk about this problem. But it's going to take the folks that aren't in this room to really fully engage in a cohesive, complete strategy to address these problems.
So one more thing. I'm looking at these photographs right here. I have an idea of what this bunny rabbit thing is. Can you explain the significance of that and what we're looking at right there?
I will turn to Kelly or Jake.
So this is 1 kilo of fentanyl powder that was seized during the investigation, and oftentimes we will see different organizations put a stamp or mark or logo on that. So that is what you're seeing is a close-up picture of that.
Sometimes the organizations, they differentiate that from who produces it, where it's going to, so we can see all kinds of different markings on those, depending on what the drug is also.
Thank you.
Thank you very much, guys.